I just parked at work and I was looking at my calendar, and of course I prepare for all my patients in advance, so obviously it's not my first time seeing my calendar, but I thought I'd share what my day looks like as a pediatric psychologist. So for example, today I'll be starting with a brief supervision with one of our fellows before we see a new consult. The consult means that it's an inpatient patient. That's for pain and coping with admission. Then I have a new patient intake with one of my practicum students. Not quite sure exactly what the presenting concern is, but again, my referrals are usually GI, neurology, urology, or allergy and immunology. Then I have a patient follow-up for a chronic painful medical condition who also has FND. And then I have another patient for encaprices. So all in all, 4 patients, 2 new patients, 2 follow-ups. I did have 1 cancellation today for a brain injury patient. So I was supposed to have 5. And then we're kind of leaving some space open for potentially a plastic surgery inpatient follow-up, but I might do that one tomorrow depending on their availability. And I also have a chronic pain inpatient follow-up as well. So hopefully they're also available so I can kind of see them today or maybe tomorrow if I can't get a hold of them. And now it's the end of the day, so I can hop on and kind of share what actually happened today. So in the morning we tried to do the consult, but we couldn't because we didn't have a caregiver present, so we have to call and get consent before we can see them. So that I end up doing a different pain follow-up, and that was fun to see a patient again, although of course we always wish they weren't admitted. Then my DI and next 2 patients did show up. I'm still waiting on my 4 p.m. patient to see if they arrive today. In which case, if they don't, then I'll spend time following up and calling them. I didn't get to my plastics patient today, but I will try to do that a different time this week. But there weren't any acute concerns, so I felt pretty confident in that. And then lots of time now to write notes. So that's gonna be the rest of my evening today.